the members that are on this it's bipartisan. We have myself, Senator Benson, Chamberlain, Champion, Cohen, Kent, Marty, Pratt, Rosen, and this time we also have Senators Ingebretson and Carlson with us as well. And so that's the group that's going to be on this. Thank you all for listening. Last week we started the process with a hearing on healthcare, and we looked at all the issues related to that, really got some good ideas out of that. It became obviously apparent that we needed to make sure that we had all the resources we had for the frontline workers, the nurses, the firemen, the police officers. And so that really was a strong motivation to make sure that we worked with the governor to get the resources he asked for as soon as possible. And also they had a conversation about making sure workmen's compensation took care of covering those people. And we moved forward with that in an aggressive manner. We signed off on legislation that we will get done Tuesday. So that's where these meetings are important. We get a chance to hear what's actually happening out there. Then the second one was just taking a look at the livelihood of Minnesotans. What are we doing related to trying to keep as many employees working and as many small businesses from failing as we possibly can? And we'll continue to work on that one as well. And so today, we're looking at our state government. We have to take a look and see what are the things that are happening as a result of the drop in revenue that's happening across the state, it's happening across the country, and what kind of decisions may we have to address related to the fact that we're going to have significantly less dollars. And so, and I've asked Senator Julie Rosen to be the moderator for this one. And so with that, Senator Rosen, take it over.
Well, thank you, Senator Gazelka, and hello to all the members, and welcome to our testifiers, and thank you very much to the public that are tuning in right now. And a special welcome to Senator Ingebretson and Senator Carlson for joining us today. Appreciate that. As Senator Gazelka said, we are going to be focusing on the state budget with a lot of attention from Commissioner Myron Frans and from our state economist, Dr. Laura Kalombokidis. But in between that time, I'd also like to have a summary from what Eric Nauman, our lead fiscal analyst for the Minnesota Senate, has put together on our federal coronavirus relief fund. But with that, let's start with Commissioner Frans. Welcome, Commissioner. And if you could just give us a brief summary of what you know, where we're at, and we would love to hear from you.
Muted. Yep, there we go. Yeah, I've given a lot of great speeches this last several weeks, but I've been on mute, so no one's heard them. And always you have to go to that mute button. Well, thank you, senators, all of you, for letting us have this opportunity to talk to you today. And I think one of the things we've been trying to do is figure out ways to share information and give you updates on what's going on. And I'm glad that Dr. Kalambokidis, who is on here as well, can talk a little bit more about some of the challenges that we have with the data and where we are on that. Many of you know that April 10th is when we come out with our quarterly economic report. And I'll let Dr. Kalombokidis talk about the challenges and what we're going to know or not know on that particular time. One of the things that clearly we all know is that the spending has increased some with some of the emergency expenditures that we've been granted from the legislature, and we thank you for that. And we also know that revenues are shrinking. We just don't know sort of how fast they're shrinking at this particular time. So I think one of the things we want to try to do is figure out ways how to model and track that information so that we can provide better estimates of where we are with respect to our budget. One of the things we do know is that it's not just the state government that's hurting. Obviously, businesses are hurting with revenue changes and businesses being closed. And so I think we want to make sure that we're aware of that and we're cognizant of that. We do know that some of the things we do know is that we do have some federal funding that's coming our way. We just don't know exactly when or exactly how we can spend it. We have we know that the federal we should get the right name of the bill, the Coronavirus Relief Fund had $150 billion allocated to the states. And of that, Minnesota was slotted to get something a little over $2.1 billion, with $1.2 billion coming to the state of Minnesota and the other almost $1 billion going to local units of government. We know that this is a reimbursement model, that it can be used to reimburse states for COVID-related expenses. Now, we don't know exactly how that's going to be defined. We have some teams working on that. We actually have an offer and we're working with Accenture has a team who's providing a free advice and support for us to understand the flow of federal funds and the restrictions that are on those federal funds. So we look forward to working with them to make sure we get that money as soon as we can and deploy it where we want to. The other thing that we do know is that the unemployment claims, as you know, I've been following Commissioner Grove and what's happening at DEED, have been really high, and that comes at a shock. There are some federal funds supporting that as well. But I think one of the things that we really want to do is make sure that we and the state government mirror the hard decisions that local businesses have had to do. And so one of the things we've done is to make sure that every employee who can telework is teleworking. Clearly, that's the primary goal, to provide ongoing service and reduce the risk, the COVID-19 risk. We've been able to, I don't have the exact numbers, we're still getting some numbers on that, but we've increased well over 20,000 out of the 35,000, the number of people who are teleworking. Now, as you know, there are a lot of people who can't telework, who provide priority 1 and 2 services. Those are services that provide safety, security, financial operations of the state. So if you're working in a 24/7 institution, you obviously have to show up. And if you're providing some of the financial work that we need to maintain, we ask those people to show up too. But whenever possible, we still go to the model of having people telework. We're also trying to make sure that we redeploy people. Some agencies need more workers because they have some vacancies that are due to COVID-19, and we're allowing through a redeployment center for our workers to be redeployed within their own agency or within two other agencies to support the different work, to make sure the really critical work is being done for state government. But let me tell you a little bit about what we don't know. And unfortunately, that list is a lot longer than I would like. I know we all are concerned about where this is going and how it's going to affect our budget. We obviously know that the budget we passed last May is not operational anymore, in the sense that the $1.5 billion surplus is literally not showing up every day. Less and less of that is showing up. So we're trying to figure out, how do we marry up the revenue that we see coming in, and Dr. Kalombokidis will talk about that, with the spending that we're doing in state government. So part of what's going to help us is to know soon. We hope to get guidance from the federal government by April 13th, and the money no later than April 24th. How can we use that money to shore up the expenditures that we've already made related to COVID-19 and that we may be making in the near future, to reduce that pressure on the state government budget? So we're looking, that important information will be coming. The other thing that we need to also know is that we want to make sure that we're responding with these emergency funds appropriately. As you know, and all of you talked to the governor about, the priorities are making sure that we increase capacity in terms of beds and ICU units, so that we have those available when the full amount of this wave hits Minnesota. We also want to make sure that we have the right supplies, personal protective equipment. As you know, almost everywhere there's not enough of that. So that's important. And third and finally is the testing, to try to increase testing to make us have more visibility into where this is happening and where the hot spots are. So that is where our primary focus has been. And some of you are on the COVID-19 Minnesota Fund Legislative Response Commission. And so you've gotten a lot of requests, I think at least 11 that I count, over the last week, where we've asked you to approve the purchase of respirators, ventilators, cloth masks, face shields, gloves, gowns, surgical masks. And so out of that $200 million in the COVID Minnesota Fund, we have obligated almost $69 million, a little over $69 million. Now, we haven't spent all of the $69 million. We've gotten your approval to spend it if we can get the mask or the gowns at the price that we've told you about. But that still leaves about $130 million that we still have yet to obligate. But I will tell you, though, we haven't gotten to the really big ticket items in terms of extra capacity or ICU units. Those are the things that are going to start costing more money. We're also going to have some requests from agencies. I think one of the things we've learned is that some of the 24/7 operations, for example, Department of Corrections and Direct Care and Treatment, are likely to have some direct increased costs in setting up new procedures and mechanisms to deal with the COVID-19. So those also are not going to be inexpensive requests. We're working through those as quickly as we can. So I'm trying to give you a little snapshot of that. We're trying to figure out how to manage these different buckets of funds that we have available to make sure we use them exactly as we should, quickly as we should, and as effectively as we can. And at the same time, monitor what are the new expenditures and what are the ongoing expenditures that we think that really be difficult to change at this point, that the public expects these services to be provided. You know, I will give a little shout out to the state workforce. I as both the chief financial officer and the chief human resource officer, I have seen firsthand people step up. Obviously we know about the troopers and the frontline health responders, but we have people, in these institutions who are working really hard, long hours, no vacation. But it goes all around the DEED, the Department of Health, DHS, and MMB, and Department Admin. I mean, every agency I can think of, I've just seen people work nonstop and just give up taking time off and give up vacations in order to be ready and to try to help respond. So I just want to give a great shout out to all those state workers who are doing really difficult work. And all of us know that it's challenging. None of us know sort of the individual risks that we take day to day that might come back to affect us personally. And we have to really deal with that on a regular basis. But people have just been doing a great job in helping with that. I feel like I'm talking too much, so I think I'll stop there. Would you like Dr. Kalambokidis to do her presentation next, or do you want to ask me some questions, Madam Chair?
Thank you, Commissioner. And no, you're not talking too much. And I do appreciate that shout out to our state workers and actually to all the small business owners and the folks that are definitely on the front line besides our healthcare workers. But I thought perhaps we would go to Dr. Kalombokidis first, and then we could have questions for the both of you after that. And then after that, we'll go to our next testifiers. But welcome. Good morning, Dr. Kalombokidis. There you go.
Am I unmuted now? Okay. All right. Well, thank you for this opportunity to talk to you about what's been going on in the U.S. economy, what we know, and as the Commissioner said, what we don't know about revenues. You know that we have a quarterly report coming out on Friday, and what we do in those quarterly reports is we describe how the U.S. economic outlook has changed since the last time we produced a forecast, or the last time we produced an economic outlook. And we also report on how tax revenues are coming in compared to our prior forecast, which of course is the February forecast. So what we're writing about now is the April outlook produced by IHS, our economic consulting firm. They normally produce a U.S. forecast once a month. They release it the first week of the month. In March, they released 3. So they released their March outlook, and then they released one on March 13th, and they released another on March 20th. Those 2 interim forecasts showing increasingly deeper recessions for the U.S. Their April outlook is materially marked down from the interim March outlook. They now estimate or are forecasting a decline in GDP annually for the United States of 5.4%, which is a contraction for the year. They expect 3/4 of contraction, so a relatively small contraction for the first quarter, a really deep one for the second. And then for the third as well, they expect positive growth to pick back up at the beginning of next year. The downgrade or the material markdown of the outlook it has reflects their view that activity will not begin to turn up materially until U.S. cases of COVID-19 are driven essentially to zero. And even then, it may take some time for consumers and businesses to resume spending and investing in earnest. The outlook that they released at the beginning of April, on the 2nd of April, includes the effect of the recently passed CARES Act by the federal government. They don't see that so much as a stimulus package because they don't think it has quite enough in it to be stimulus. They're calling it more of a preservation package. What they've said in some of their conference calls to clients is that, yes, providing stimulus is what the federal government should be doing at this time, but there's only so much you can do when people are still under orders not to leave their home and businesses are under orders to stay closed. And so that's why they're seeing this more as a preservation package than an actual stimulus package. And so the downgrade from the previous outlook reflects some new economic data at the U.S. level. We don't have much at the state level, but also their new judgment on how efforts to slow the spread of the disease will permeate the economy. So as you know, this, when we first started looking at the risks of this outbreak, we talked about supply chain disruption. We talked about stock market volatility and how declining asset values creates a negative wealth effect in the economy and consumers might spend less. We talked about lower demand for U.S. exports and Minnesota exports to Asian countries that were the first ones that were affected by this. But what we didn't anticipate was this tremendous demand side shutdown. So this tremendous demand side shock, which is really unprecedented, shutting down large parts of the U.S. economy. And so as those policy changes have been made, and as they've moved around the country, the macro forecasters have been incorporating that demand shock into their outlooks. I don't know a lot more about the new U.S. outlook because IHS hasn't released their full explanations and narratives, but hopefully I'll have more information that I'll write up in the Friday report. We'll certainly write up everything that we do know at the time. In Minnesota, we don't, as the commissioner alluded to, we don't have a lot of new real-time economic data. The economic data comes at a lag. It lags the real economy, so what you're seeing day to day in the news. The one thing that we all have been watching happen that has happened with more in real time is the unprecedented surge in unemployment claims. I think in Minnesota, it's in the order of 300,000 new claims since mid-March, and that's really unprecedented and just a tremendous spike. And we see that in the unemployment claims data. We don't yet have new employment data or unemployment data for the state. And we don't yet see that fully playing out in the revenue story yet. And so let me talk a bit about revenues and what we're going to be writing about. So what we always write about in the April update is we compare revenues in February and March to what we had forecast in the February forecast. And so we will do that. This is a report that maybe to the, Commissioner Frans knows this, that it's not a report that we can put out, create a draft a couple of weeks early and then have people review it, at their leisure, because we tend to get data at the very last minute. And so right now I have preliminary data, but we're still putting together final data on that. And so we won't know the final revenue story until we actually produce this thing. But to give you an idea of what we're looking at in terms of time lags, so the April report reports March receipts, so February receipts and March receipts. I don't always differentiate those things in the report, but I'll do that to the extent that that's helpful. I will do it this time, so that people understand the difference between what happened in February and what happened in March. But looking at sales tax, for instance, we'll report March sales tax receipts, and normally March sales tax receipts would reflect February economic activity, so February sales. But for businesses that delayed their March 20 payments, so the payments that were due on March 20th, they were allowed to delay the businesses that were identified in the executive order about businesses that had to close. Those businesses were allowed to delay their March 20th payments until April 20th. And so we're not going to see February activity related until the next monthly revenue report. But you should expect that gross sales tax receipts in March will be lower than forecast. So one of the things we're trying to sort out, and I don't know if we'll get it sorted out by the end of the week, but one of the things is trying to figure out, to the extent that there's a shortfall in gross sales tax receipts, how much of that is because of the delay and how much of it is actually lower economic activity. And then, without further payment delays, we'll see sales tax receipts for April, which reflect activity in March. And March is the month when social distancing and business closures took hold. We'll see that at the beginning of May, unless those payment delays are extended. So whenever when we allow payment delays and extend payment delays to help the businesses that are trying to make things work and keep their heads above water right now, that delays the observations that we have of the economy. We often look at sales tax receipts as reflecting current activity, so not previous activity. But now that signal is getting muddied. We'll also report March income tax withholding receipts, and withholding receipts are another measure that we use to look at that reflect current year activity. But it's taken a while for withholding receipts to reflect the change in employment and the change in payrolls. It's only in the last week that withholding payments have begun falling below our forecast. But you should fully expect withholding to continue to deteriorate as the record surge in layoffs is reflected in Minnesota employers' payrolls. So as you look at the unemployment insurance claims, know that every one of those claims means less income tax withholding. We just aren't seeing it yet. There's going to be a lag. It's almost like waiting for a reverse tsunami. The people working on the front lines in medical care in Minnesota may feel like they're kind of waiting for a tsunami of patients to come in. We're waiting for a tsunami of revenues to not show up. And also regarding current year revenue activity, by May 10th, we should know estimated payments for the first quarter of calendar year 20. We don't know that now, but we do expect that those to come in well below our February forecast. Another thing that's affected by payment delays is the income tax payments for tax year 19. So normally we would get a fairly full picture of tax year 19 income tax final payments and payments with extensions by May 10th. But with the payment delay, where Minnesota followed what the federal government is doing, allowing people to make those payments in July, we won't have complete information until August 10th, if even then. And the timing of that signal, so normally that's a signal that we would have pretty, next month, but we won't get that until later in the summer. And the timing of that signal is going to depend on how quickly Department of Revenue can process returns under current conditions. So I will leave it there, and I'm happy to listen to questions for either the commissioner or me.
Thank you, Dr. Kalombokidis. We have a couple questions, but first I wanted to ask either you or the commissioner, when would be the the most appropriate time or the earliest that we could ask for a new forecast on our revenue?
Oh, that's a great question, right, Dr. Kalombokidis?
Yeah.
So the challenge, and as Dr. Kalombokidis has already started talking about, the challenge is making sure we have enough information, enough good new information to make it worthwhile. Obviously, we do 2 forecasts a year, in November forecast and February forecast, and as she already talked about, there's some data that we won't even know until this summer. So the real question becomes, when will that tool become really helpful for us in understanding both the effect on 2020, fiscal 2020, and obviously the biennium 2021? So anyway, it's a real toss-up in terms of when that gets enough, when we get enough information. I'll talk a little bit more about the deficit and use of the reserve in a minute, but I'll let Dr. Kalombokidis add any comments she has.
Yeah, that is a valid question. I want to know the answer to, but I respect the question, and I know that you all need to know what's coming down the pike and what we can expect. I would just reiterate what the commissioner said, that I want to produce that information at a time when it is useful and credible and not just adding to confusion or noise. And we are thinking about it. We are looking at what we can do with the information we do have, and we will provide the best information we can at the time that we can. What else did I want to say about that? So one of the things there, in addition to the revenue, the lack of signaling that we're getting from revenues and the lag in the revenue data, another issue that I'm thinking about in regard to when we can project what's going to happen to revenues for this biennium is that the U.S. outlook is highly volatile right now. We went from 2.1% forecast growth for fiscal or calendar year 20 in February to what did I say, a 5.4% contraction now. And so we want to, if we do a new projection, we want it to be based on something that's reasonably solid, so that we don't release something and then the U.S. outlook changes again materially, and then that's no longer relevant either. So that's where we are.
Absolutely. Thank you. Thank you for that. I know Senator Gazelka and Senator Cohen have a question. Senator Gazelka?
Thank you, Commissioner Frans. 2 weeks ago or so, you gave us a projection of what would the scenario be if the numbers were like the Great Recession. Because frankly, I think this is worse than that. And just wanted to identify another sector that I think we're going to have problems with unemployment is our healthcare. Because of the closing all the surgical units, they're all in dire need, and I think have begun to start laying off people, and so that needs to be figured in as well. But can you talk about the projections that you showed us so that we can bring that into this conversation as well?
Sure. Let me just set that up.
Commissioner Frans.
Thank you, Madam Chair. I'll let Dr. Kalambokidis describe that. I think one of the things that was interesting for us, and this always happens, right? Every time we come up with a difficult situation, there's never been anything quite like it before. I mean, the Great Recession was obviously one of those recessions that we had never really experienced before. So one of the things we wanted to do a couple of weeks ago was to provide the governor and you all with some ideas about how fast and how deep can revenues drop when that happens. And so I'll let Dr. Kalambokidis explain sort of how we set that up and what the results were. Dr. Kalambokidis?
Yeah, thanks, Commissioner. Thanks, Senator, for the question. So this was, I don't know, was this a couple weeks ago now, a week or two? I can't remember. But we were trying to figure out a way to convey the gravity of this situation, given that we didn't have enough information to actually reproject revenues based on new economic conditions. And so we did this thought exercise where we used the Great Recession as a model. And so we looked at how revenues declined from year to year throughout the Great Recession. And we looked at income, sales, and corporate receipts, the big three. And we laid that experience on top of our February forecast to say, what if we had an event, this coming event? We knew, I don't think we had a projected recession at the time, but we knew it had to be coming. So what if we had an event that's like the Great Recession, and we looked at something that's 50% as bad, half as bad as the Great Recession in terms of revenue shortfalls, and 100% as bad as the Great Recession. In retrospect, perhaps we should have done 125% as well, or 150%. So we produced those two scenarios, which I believe you've seen. A couple of things to remember about those revenue scenarios. First of all, it's not a reforecast based on new economic data. It's a take this experience we had and let's lay it on top of our February forecast. For each of our scenarios, we assumed that fiscal year 20 would end okay, that fiscal year 20 would be unaffected. And so that was not because we necessarily thought fiscal year 20 was going to end okay. It was because it was just to make the thing tractable. So let's start with fiscal year 20 ending okay. So when you look at the results of that, of those scenarios, know that fiscal year 20, we're already seeing revenues decline from forecast for fiscal year 20. You'll see some of that. You'll see that on Friday, the most information we have on that on Friday. So know that assumption was only to make the thing tractable and doesn't really hold. It also was before we had those revenue payment delays, those tax payment delays. And so that also changed revenues in fiscal year, will change revenues in fiscal year 20, hopefully moving them into fiscal year 21, but there's uncertainty about all of that. And so the result of the 50% as bad as the Great Recession story was that revenues would fall short for the biennium would fall short $1.5 billion relative to our forecast. And in the 100% scenario, revenues would fall $3 billion short. We didn't do the same experiment on the spending side. So no, we didn't do let's see how much spending increased during the years of the Great Recession and lay that on top of our February expenditure forecast. We just added in the new spending that had already been enacted at the time. And so, so that led to the 100% scenario leads to no money in the budgetary balance, so a zero budgetary balance, and having used all but $547 million of the budget reserve. But when I see that, when I look at that chart now and see that money left in the budget reserve, I have to remind myself that was assuming that FY20 ended okay, and it was assuming that the recession scenario that we're heading into is not worse than the Great Recession. And of course, all sorts of other things could be going differently. So, so those are some of my points of caution about that scenario. I hope you all found it helpful in the absence of a full forecast. Just the message that we're not going to get all the money that we had expected.
Yeah, and as a follow-up, I mean, that's why we're right. Thank you, Madam Chair, whatever you are for moderator, but it raises the red flag of caution about why we're having this meeting today, frankly, and what are the things that we can do right now to bend that curve a little bit. And so it's part of the reason I've been advocating for the businesses that are safe, whether it's landscaping or golf courses or putting docks in or whatever, that we find a way to let them get back to work, because it also means that we get more revenues coming into the state. And I know the governor's thinking about that too, so this is not meant to be anything like that. But as we move forward, though, I'm hoping that there's some conversations about hiring freeze. What do we do about shrinking the footprint of state government, because we know that we have a huge problem coming up upon us as we're moving forward.
Madam Chair.
Commissioner Frans.
Madam Chair, and thank you, Senator. I think it's a good point. And one of the things we've already instituted is a hiring freeze, except for those priority jobs. So obviously, if someone at corrections or direct care and treatment. If they need support, we allow them to hire behind. But we have stopped the hiring for what we would call non-critical positions. So that's number one. And again, good point. And you had suggested that to me some time ago. And I think, so that is one key. And the other thing, though, we had to be careful about, and that's why this is so hard, because our actions need to be really surgical and targeted, because there are a lot of services that we want people to get. I mean, we've flexed a lot of the licensing requirements, but nonetheless, we still need to process a lot of things so businesses can keep working. So we've got to make sure that as we figure out, and you and I have had a lot of discussions about the scope of government and the size of government, how it should work, how it can work better. We've got to make sure that as we adjust to this new situation for a while, that we keep the right services there and full. One of the things we've been able to do a lot of is to provide our services teleworking and online. So that's going to be something I think in the future we'll probably end up doing more of. But to your point, I think you're right. We do want to make sure that as we go through this process and we assess where are the best places to deploy people to make sure they support the needs of people. And as you know, during economic downturn, we see some needs and service needs go up. So it's a mixed bag, but we're trying to manage that and try to get our hand on more timely information. It's hard. I think one of the challenges we also need is real-time data, right? I mean, I think one of the things that we're used to is not having to move so quickly. And this is really forcing all of the agencies and the governor to really demand really quick turnaround on data to make sure you're pointing your resources and your people to the right spots. But I appreciate your comment.
Dr. Kalombokidis, before we go to Senator Cohen, just a quick question. You mentioned that the federal coronavirus relief fund is not really a stimulus package, it's a preservation package. What would you constitute as a stimulus package? Perhaps a bonding bill, but is there anything else that would be classified as a stimulus package that we could do on a state level?
Yeah, so I was repeating what IHS has said when I wanted to make sure that you knew that they have incorporated the impact of that federal package on the U.S. economy. They have just been cautious in saying it doesn't make as big a difference in their forecast as you might expect given the size of the bill because of the nature of the problem. And so I would actually probably call it a stimulus package because it's trying to stimulate activity above and beyond what we would have without it. So it just may not have as much of a impact and give as much of a boost to growth as we would hope. Regarding the state, so you all have heard me say that because the state has to balance its budget and the federal government doesn't, that doing that stimulus spending at the beginning of a recession is best done by the federal government because they can deficit finance it. And that's what they're doing. They're financing it with increasing the deficit. And the federal government can do that. Eventually, it will come back, it has to get paid, but it doesn't have to get paid immediately. And it's such a challenge and such a frustration at the state level to know that if you try to spend something in one place to generate activity, you're going to have to take it away from somewhere else. It's a zero-sum game. And then, so how can the state do that? So I would, given the landscape that we've laid out, that the money that we thought was coming in is not going to be there. And so that limits what we can do. Is I would reiterate what the commissioner said, which is anything that we do at the state level needs to be more surgical and more targeted than what the federal government is doing. It's the right thing for the federal government to do to offer stimulus and offer spending that will affect a wide range, a lot of people, in particularly people who are more likely to spend the money, which is people at the lower end of the income spectrum. People who are lower income spend all of their money. And so when we offer them more money, they will spend that. And that's helpful. So but the federal government can do things more broadly. The state, with very limited resources, I think it requires you to be more careful than the federal government is being even. So targeted activities, are there things that can be done that don't require additional spending or won't further restrict the revenues that are coming in? Thinking creatively, working with the businesses that are on the front line here, who, as Senator Gazelka said, there are businesses that have information about their own operations that can help us make decisions here about what we should do next.
Okay, thank you. And I would assume prior to a new forecast that you come out with, Dr. Kalombokidis, you'll have another Council of Economic Advisors, a discussion or something that we can be involved in to hear that forecast.
I hadn't thought that far ahead, but I don't see why not, especially, since I wouldn't literally bring people in, but we certainly can have a conversation like this with our council. Absolutely.
For sure. Thank you. Senator, we have 5 people asking questions. Senator Cohen, you've been waiting patiently.
Yeah, thank you. First, just a comment. I know in 2010, we had 2 supplemental finance bills based on the February forecast, and then as further information was available, we had a second supplemental finance bill at the end of the session where we were cutting money in both instances as revenue started to drop. And I also know at some point, and I forget which year, and maybe Sarah Rosen, you might remember, maybe Eric Nauman might remember, and Dr. Kalombokidis, and looking at past records, there was some kind of promulgation of an interim budget forecast, but I forget what, a formal budget forecast, but I forget what year that was. First of all, if I can, a question to Dr. Kalombokidis. You've talked about...
Senator Cohen, we can't hear you too well.
Oh, you can't? I'm sorry.
Thank you. That's better.
Okay.
That's better.
Sorry, let's look at some notes. Sorry. Let me
That's okay.
shift the notes. Okay. So, Dr. Kalombokidis, you talked about projected GDP based on the February forecast of, I think it was 2.1 and 2 in the fiscal years. You talk about a contraction of 5.4% projected now. To draw a contrast, what was the GDP? And I realize it wasn't the same quarter by quarter or year by year, but by comparison, if you can make a comparison to what it was 10 years ago.
Dr. Kalombokidis.
Senator, thanks for that question. Do you mean, so during the Great Recession? Yeah, so the Great Recession I did look that up. We had negative growth for 3 quarters in that recession as well. The decline from 08 to 09 annually was 2.5%, but from peak to trough, so that's how we look at how much we lost during a recession. And we don't know what the peak or trough is for this one yet, so we can't compare. But that was minus 4.3% from the fourth quarter of 07 to the second quarter of 09. It's a great question. So this, as I said, when we did our 100% Great Recession scenario, that I think that is informative because it's similar in that right now we have a projected 3 quarters of contraction, but the pattern is different. This one has just started with a bang. We just slammed the door shut on the economy. So it's starting much more abruptly, and that middle quarter contraction is much bigger. But the economic fundamentals were better to start. And so we might, that speaks to when we get back into business, maybe the recovery is faster. I don't know that yet, but I'm certainly thinking about the comparisons between this situation and the Great Recession.
Okay, so,
Senator Cohen.
So using that number of the 4.3, then if you assume, and I recognize that it's a little bit of apples to oranges, and and this is guesswork at this point, but if you assume for the sake of argument comparing the 4.3 to the 5.4, that would suggest 125% number roughly. and give or take.
Well, Senator, if you don't mind, I think that's not a bad way to look at it. But the reason we did our recession scenario the way we did, which was is so that we could look at how that recession affected Minnesota's revenues and not try to extrapolate from what happened to U.S. GDP. As you well know, we don't tax GDP. We tax spending and consumer spending and income and profits. And so that's why our recession scenario, we looked at how Minnesota's revenues declined in those years and laid those percentages on top of our February forecast. So I think that's where we landed on what's the most informative way to illustrate this now.
Okay, and Senator Rosen and Dr. Kalombokidis, I recognize that, again, this is guesswork, but you used a figure of $3 billion for the rest of the biennium potentially, and you said that if you assume that number, you would leave about $500 million in the budget reserve. I assume you're not taking into account then the cash flow account at this point, at least using that extrapolation.
Right.
And it also assumes you don't get back the $491 million that was taken out of the budget reserve. Correct? That's gone.
That happens at the beginning of FY22, if I remember correctly. Now I'm getting into the budget director's expertise and not mine, but I think that the 491 comes out at the beginning of FY22, and this analysis just went through FY21.
Okay, so I'm glad to ask the question then that you're anticipating the utilization of a budget reserve of whatever that 2.3 number is then.
I'm sorry, say that again.
So Senator Rosen and Dr. Kalombokidis, with your extrapolation, again, a little bit of back of the envelope.
Yeah.
You're suggesting the utilization of the current $2.3 billion budget reserve before the start of fiscal 22.
Yes.
Okay. If Senator Rosen, so thank you. If I could, I don't want to take up time from others. Senator Rosen, if I could just ask the Commissioner a couple of quick questions.
Yeah, Senator Cohen, we're going to lose the commissioner at 12:30 or perhaps 12:20 or so. So yeah, please do. And then we've got a few other people that like to ask a question.
Okay, yeah. So very quickly, Commissioner. I understand what Dr. Kalombokidis talked about. What's your expectation then in terms of where we might be? If would you be coming to us asking for some kind of a supplemental finance bill that would be a cut bill before the end of the session?
Am I still on? Okay, yeah. Madam Chair, thanks. Madam Chair, Senator, I think one of the things we want to try to do is to give you all as much information as we can before May 18th. Now, obviously, May 18th is not the magic number. We'll come back to you whenever we need to this summer. So, but in terms of trying to give you a better sense of the budget outlook, one of the goals we're trying to work through is when we get the information for April 10th and we talk to Dr. Kalambokidis about that and what we think we'll know at the 1st of May, can we at that time, the 1st of May, provide you with a better outlook about what the state budget looks like, at least for fiscal year 20 and 2020 and 2021. I don't know that we'll have a very good answer for beyond that. So I think it's a little premature for that yet, but it depends in part on what we think, how much of that budget reserve that we might feel like we need to access. So that's, and remember, there's a couple of ways to access the budget reserve through the deficit. One of them is through a forecast, obviously. And another one is if under the statute, if we determine that I want to get the right language, if we determine that the budget reserve may be used if there's a negative budgetary balance is projected when you use objective measures like reduced total wages, reduced retail sales, or increased unemployment that reflect a downturn in the state's economy. So it's possible, I don't know yet, it's possible in May we will come to you and say that might be at the point, or we may not be there yet. I have to say, I'm sorry, I don't know the answer to that question.
And we look forward to participating with you on that too, Commissioner. Senator Cohen.
Senator Rosen, very, very quickly, for the commissioner. Is the 1.2 billion from federal government directed only to COVID spending, or does that cover a deficit without specification?
Madam Chair.
Yeah, Commissioner.
Yeah, it's related to reimbursement for COVID-related expenditures.
Okay.
And Senator Cohen, we're going to have a review of the federal funds as much as we know in a few minutes.
And Senator Rosen, my last quick question for the commissioner is, our comment is that where you don't know what else might be needed, we've appropriated $550 million. If we need to appropriate more for the COVID emergency, but we're now in deficit, that's where I'm wondering if you come back to us and say, look, we've got to cut spending because we're going to put it into COVID.
Commissioner.
Well, Madam Chair, Senator, I think you're right. I mean, the way I look at it, I sort of view this constellation of stars up there, and here's the budget that we have that we know is in difficulty, the revenue stream, which is changing as we speak, and then these federal funds that can help backfill some of the expenditures that we want to make, but not all. And as you indicated, part of what we're going to have to figure out is what do we do to those agencies that are supported in part by revenues. The zoo is a good example in terms of not having the revenues from the gate receipts, and there are other agencies too. So we've got this complex set of agencies, some of which just live on the general fund, and we can control that funding spending, and some who live on a combination of other funds, and it's that total fund. The highway the highway trust fund is another area. We're going to have to analyze that. We've got to analyze the sales tax that goes into all the legacy funds, right? I mean, all of us know that those funds are likely now in a situation where they're likely going to be overspending. We're going to have to sort of bring those into line. So there are a whole series of decisions like that need to be orchestrated, I think, and give you all the picture so we can collectively figure out what's the best way to proceed.
Thank you, Senator Rosen.
Thank you.
Commissioner.
Thank you. You bet. Thank you, Senator Cohen. And we have Senator Ingebrigtsen next.
Am I muted now?
No, you're good.
Okay, unlike Senator Cohen, I don't have 5 final questions here. I've only got a couple. Real quickly, the hiring thing, a lot of the department heads are concerned about hiring freeze, and you said there was going to be one, Commissioner. I appreciate that. However, with the obviously downturn out here and everybody else losing their jobs, the unemployment rate, is there something a list that you can give us to assure us that, one commissioner might say this is an essential employee, the other ones might say this was essential. So have you got a list of that? I know the Department of Corrections is certainly going to be a priority. Major things, infrastructure things. Have you got any kind of a list at all of those who cannot maybe, or the ones that are essential? And also the second question I have, and that'll be it, as a budget chair myself, how do you suggest that we move forward here without a forecast, or how soon do you think you'll have something else to work on? Because I do remember the years of 11 and 12 were miserable at best for everybody that have to deal with a deficit. So can you just give me a little idea as to how we move forward? Thank you.
Commissioner.
Sure, Senator and Madam Chair, thank you. Well, we do. So we went through a pretty exhaustive process. We've done this before when we've had federal shutdowns, for example. We have to analyze what are the critical priority services 1 and 2. What are those life and safety protection 24/7 operations we have to maintain? What are the financial operations we have to maintain for the financial security of the state? But this particular situation posed a more difficult situation because to the extent we could have people telework, that provided an option that really helped alleviate the concern about people's health risk and helped support the idea of minimizing transmission. So this was a different analysis than saying you don't have enough funds or you're going to have some funds removed. This was a situation where some of your funds may be gone because people aren't engaged in those activities, so you may lose the revenue. But it's more, how can we provide the service and not affect, support people's being healthy. So we do have a list, and we went through that. So we went through a process, Senator, where people and agencies proposed to MMB who was on that list. And I'll see where we are with sort of the final analysis of that. I think we've really finished that over this last weekend. And so I'll put together a list and get that to you and the committee here. And that may take a few days to do, but I appreciate the question about that. So
Thank you. We really
Right.
appreciate that.
Yeah, you're right. We tried to make it more of a central analysis, not an individual one-off kind of analysis. But you raise another point, and that is, with the unemployment the way that it is, we did not want to exacerbate the unemployment, and yet we didn't. We wanted the state workers to be able to provide essential services or critical services. So there's kind of a dilemma there. But I'll get that for you. On the other issue about how long before forecast, I remember $6 billion deficit in 2011, and a lot of us on the phone call remember that as well. So I was hoping that I would get out of this job before we had a deficit show up. I guess I stayed 1 year too long, but so I don't know the answer. You're right. I understand. I feel the same way that you do, that we're driving really fast down a road blind, and we can't see 5 feet in front of us, and we know there's a big bump coming up, and we don't want to overdrive. We don't want to overextend ourselves so we can hit that bump and we know what it's like. So all I can give you at this time is my pledge that we'll do the best we can to get some concrete data, start doing some modeling that we think will give us the right analysis that makes that determination. As I mentioned, we can also do a budget projection that does somewhat the same thing without the full-blown forecast analysis, and we'll figure out what's the best time to do that for you. But I don't know. I'm sorry, I'm saying I don't know a lot, but I don't know right now.
Thank you, Commissioner.
And when you have that estimate, I would assume you would get that out to us right away, Commissioner. Correct?
Oh, absolutely. Yeah, it'll be a thing, right? I mean, it'll be a thing, and we want you all to know about that and talk about it and think about it, because it's going to help to get input from you all about, is this the right way? Are we missing something?
Thank you.
You're welcome.
Yep, absolutely. And Senator Chamberlain.
Thank you, Senator Rosen, but my questions have been answered. Thank you.
Okay, wonderful. Senator Benson.
Thank you, Senator Rosen, and thank you, Commissioner Frans, for being here. My question's actually for Dr. Kalombokidis. I have two of them. One, in the projections that you did, you indicated you were only looking at declines in revenue. When do you have any thoughts on how to model what's going to happen to some of our human services functions? We know that in the first few days of MNsure special enrollment period, a great portion of the people who applied during the open enrollment period actually qualified for public programs. And as we see unemployment grow, we're going to see more applications for MA and other support. So you said that wasn't included in your number. I'm wondering if you did any look at that, or if that's something that we can wait for going forward. I do have another question after that.
Doctor.
Yeah, Senator Rosen, Senator Benson, so in that recession scenario, we just did, as you said, we just did the revenue side, and then we incorporated spending that had already happened since the forecast. Modeling what the expenditure projection, that's not my area of expertise. That would be the budget division, and we are constantly working closely with them. And as the commissioner said, when we feel like we have enough information to provide something useful, then it will be both sides of that. It'll be both sides of the story. It'll be both revenues and expenditures. So I can't, and I would encourage you to reach out to the state budget director if there's something in particular you're looking for right now.
Absolutely. And I just wanted to raise that as a finer point, because as we're talking about some of these back of the envelope numbers, that doesn't include growth in spending, and some of our most significant forecast adjustments recently have been the number of people who aren't going on medical assistance. In one forecast, there was a $600 million adjustment for people who weren't on MA, who we anticipated would have gone on MA. And so I think I just don't want people to get settled that these numbers are what we're going to end up working with if this recession plays out as you're projecting. My other question is to the type of recession. You talked about how this just dropped, everything just stopped. Is that because it's a supply side recession where the businesses had to shut down because of an externality, as opposed to, because demand didn't drop, but businesses just had to stop? And so do we need a different look at a supply side recession versus a demand side recession?
Yeah.
Kalambokidis.
Yeah, Senator, really interesting questions. First, just a comment on your point about the expenditure side. Absolutely, by all means, you've got to look at both sides of the ledger. It's the cruel irony of the impact of the business cycle on state government is that at the same time that a recession causes our revenues to decline, it causes the demand for services to go up, and you cannot look at those two things separately. So I appreciate that perspective. So the short answer to your question about the nature of the recession is that we are going to need all sorts of new tools to figure out what's going on in this recession, because it does not look like other things. So when I think of the demand shock, when I said, so we had things like supply chain disruption, and we had the volatility in the stock market and such. What I mean by the demand shock is, I think it's just another way of saying the same kind of thing that you're talking about, which is that when we had to shut down businesses, first of all, that caused some of us who normally would be spending money in those ways to not spend that money. So when you have, for instance, a natural disaster, a hurricane or something, or in Minnesota, a big blizzard, people don't go out to dinner, right? And so when the event is over, that the most consumption, most spending picks back up. So I didn't go out to dinner, but I also didn't buy a car. Well, when the blizzard's over or the hurricane's over, I go out and buy the car, but I don't buy 2 extra dinners. So there's some amount of consumption that's lost there because the opportunity to spend is not there anymore because the bars and restaurants are closed and that kind of thing. I'm not going to go out and get 3 haircuts when this is over. I'm just going to get 1. And so that I think of as a demand shock, even though I see what you're saying, that it came from the supply side of the opportunity to spend is lower. But also when we closed businesses in order to reduce spread of the disease, as you know, hundreds of thousands of people have been laid off, and that creates another demand shock because those people are not going to spend at the levels that they were before. So that's what I mean by the demand shock. So it is both a supply shock and a demand shock, and yes, it's an unusual situation.
And thank you, Doctor. Senator Benson.
Just very briefly.
Well, actually, I've got to go to Senator Kent because we're going to lose Commissioner Frans here shortly, Senator Benson. So we'll come back to you.
Plenty of time. Thank you, Senator
Thank
Rosen.
You. Yes, Senator Kent.
Thank you, Senator. And I want to come back to your conversation with Dr. Kalambokidis about what we have in terms of tools in the state tool chest when it comes to stimulus. And something that I would like to see if you could help us explore a little more is what we could be doing in terms of bonding and the role that would have as a stimulus mechanism.
Okay, thank you.
Yes.
We'll come back to that. So we'll go back to Senator Benson, and then we do have 2 testifiers and Eric Nauman wants to just go through the fiscal or the summary on the federal funds. So Dr. Kalombokidis, if you could. Senator Benson,
Rosen,
yes,
thanks for coming back. I was just going to make a fine point. No need. Continue.
Okay, thank you.
Senator Rosen, Senator Kent, the question was about bonding, the potential of that as being a stimulus. principle, having this, I said the state has to balance its budget. The one way the state can borrow is through bonding. And so putting people to work during a recession with borrowed funds, especially with interest rates low, can be a great plan. And I would add what I'm sure the commissioner would add too, which is there's an impact of a bonding bill on the budget as well. And so how much it's not free money. There's debt service on that. And so given the changing and deteriorating budget situation, that has to be taken into consideration as well. But as when lots of people are unemployed, putting people to work is a good idea if we can afford it.
Senator Kan, further questions? No? Okay, good. Well, thank you very much, Commissioner Frans, for staying longer. I know you had to take off. And Dr. Kalambokidis, I really appreciate your insight. Looking forward to being a partner and continuing these conversations. With that, I think we're going to turn to Mr. Nauman. And Mr. Nauman, if you could give us a summary of the Federal Coronavirus Relief Fund. It should be popping up. This is all new to us. It should be popping up on our screen here to just briefly go through what we do know. We don't have a lot of information. Some of it will be coming towards the end of the week. But right now, Mr. Nauman, if you could walk through this sheet for us.
Madam Chair and members, it's good to hear your voices, even at distance. I just want to ensure that you, in fact, can hear me before I argue. So what you asked me to do is to put together a document on the Federal Corona Fund, or Federal Coronavirus Relief Fund. This was enacted as part of the CARES Act in Congress late last week. And I'll mention before I go too deep in this that there's about 36 different revenue streams as part of the Coronavirus Relief Fund. And I'm going to focus my attention at this point to the one that has gotten the most attention in state governments throughout the country. And that is this single fund. It appropriated, and this would be a good point for us to bring up the summary document that I put together. I'm saying that for other folks that are going to do that for you. And I hope that does happen and you can see it. I have it on my, yep, there, it looks like something's happening. There we go. So the total Coronavirus Relief Fund appropriated $150 billion nationally. There were specific allocations set aside by Congress of $3 billion for the District of Columbia, Puerto Rico, the Virgin Islands, basically some of the U.S. territories. Then there was also an allocation of $8 million set aside, billion set aside for tribal governments, leaving about $139 billion for the states. States determine their allocation by taking each state's relative population and dividing it into the total national population, with the proviso that no individual state can receive less than $1.25 billion. And that's written into the law. So there are some states, about 15 of them, that are smaller in nature, that their population wouldn't generate up to that $1.25 billion. So they are brought up to that level, and that diminishes of the $139 billion, the amount that's available for the states. So the Federal Funds Information Service has done their analysis. Our analysis gets relatively close to this number, but the number of $2.186 billion is Minnesota's allocation. That allocation is then divided further within the state of Minnesota by the amounts allocated to local government. And this is, there is a local government allocation that is dictated by the federal law. And for local governments that have a population in excess of $500,000, you make this calculation. And that calculation is as follows. You take that local government's population, you divide it into the state population, and then you multiply it times 45%. And that leaves you with an allocation for those larger state local governments. And in Minnesota, it's Hennepin and Ramsey counties are the two that are eligible. And then everything that's left becomes available for the state, effectively the legislature and the governor, to make decisions about. So if we continue further down below to the sample calculation for Minnesota, and I'll emphasize here, members, this is done as a thought exercise. We use population data from 2018. I'm not sure exactly, we will get guidance eventually on what the proper population calculations to use are. But based on the state demographer's data, Minnesota has a population of 5.6 million individuals. Hennepin County has 1.2, and Ramsey County is 552,000. So together, those two counties are 1.8. And if you do the math exercise that I just identified, you take the total allocation for Minnesota, the 2.2 or 2.186, and you multiply that times the ratio of the population in the two counties, the two local governments that we think are eligible, and then multiply that times 45%, you end up with a number of about $317 million. And those local governments would presumably apply directly to the federal government for those resources. And then the balance becomes left for the state of Minnesota to make decisions about, basically $1.8 billion. The question that has permeated some of the discussion here already is, what can that money be used for? And the money is fairly loose with a couple of provisos. So skipping down to the very last section of this document, I have in this document essentially quoted what is in the federal law. This is section 601, paragraph D of the CARES Act. So states and local governments and tribal governments must use these funds to cover, and the commissioner spoke about this piece already, necessary expenses incurred due to the public health emergency with respect to the COVID virus. I'm summarizing briefly. Were not accounted for in the existing budget, most recently approved as of the date of the enactment of this section, and were for expenses that were incurred during the period of March 1st, 2020 through the end of December 30th, 2020. So it's fairly broad, but it's very clear, at least to me, that the money has to be used for COVID expenses. I think when you get to this point, Madam Chair, it'll be good for NCSL to speak about this, because I know they have had conversations with the folks at Treasury. What we do not see here in this language that members should be aware of is it's not for loss of revenues. So up to this point, the commissioner and Dr. Kalombokidis spoke pretty vividly about the likely loss of revenues on our existing budget. These are prospective expenses for coronavirus-related activities, and that we had to have not accounted for in our existing budget. So it's our belief that it would be important for us to look a little bit further into what the proper uses of these dollars are. But again, I emphasize that at least it's my reading that this is not for foregone revenue that we would otherwise have received had this circumstance not occurred. So Madam Chair, that concludes my comments on the document itself, unless there are questions. Again, I'll emphasize this is intended to get you started thinking about the allocations. And I'll also emphasize, because it's implied in the formula, that it's not assumed here by the federal government that only Hennepin and Ramsey counties would receive money off of this pot effectively. It's just that those are the law required only those large counties or jurisdictions rather to apply directly to the federal government. It's left to the states to take their state allocations and provide those resources to the local governments in their states. So, Madam Chair, unless there are questions, I think that probably rounds it out for me.
Thank you, Mr. Nauman. That's very good. We have a hard stop at 1 o'clock. I know we have a question from Senator Pratt. Senator Pratt, would you like to wait until the testifiers talk a little bit more about the federal funds, or would you like to ask Mr. Nauman right now?
If I could just ask a couple of quick questions right now. So, Mr. Nauman, some of the things that we've worked on are stretching into calendar year 2021. Are we able to use federal funds up until expenses incurred to December 20, and then the state must pick it up? And my second question is, one of the expenses we're looking at is increased worker comp due to firefighters, nurses, police officers hitting hospitals and local governments that don't qualify with the $500,000 or 500,000 population. Is that an eligible expense? And do we have to worry about putting money into a program where the federal government can't supplant it? Sorry, that's 3 questions.
Mr. Nauman.
So I'll deal with the date one first, and then I think the other one is a little bit more ambiguous. I think it's, if you look at the very bottom of the document, and I think Maureen has brought that document back up again, and if she can scroll all the way to the bottom, the dates that the federal government has identified in the law as the allowable uses are for expenses incurred between March 1st, 2020 and ends on December 30th, 2020. So I think it's based on what is in the law now. You know, in Minnesota, we talk about what current law is. Current law for the use of the coronavirus relief fund is for expenses during that period. So to the extent that you have expenses outside that, or that we as a state have expenses outside that period, it looks to me as if it would not be an eligible expense. So I hope that, now that said, law can be changed, and if the virus expenses expand beyond that period, it's very possible that Congress could amend this. I don't want to speak to that too exhaustively because I frankly don't know, but I mean, that's how I would review that. And I think it's also worth noting that this is but one stream of revenue. So I'm now pivoting to some of the other streams of revenue that we haven't examined here in this conversation that I think the chair has an interest in looking at another juncture. And unemployment is one of those streams. So with your permission and begging for a little bit of time on the side of the fiscal staff, we'll probably get into those issues as forward guidance from the federal government becomes much more apparent about what we can use the money for. But it might be something worth examining with NCSL as well, and I know they're coming up shortly.
Senator Pratt? Okay. So Senator Cohen, I know you have a question. I guess I've been told we can go past 1 o'clock to about 1:20. So that does give us a little more breathing room. Senator Cohen?
Mr. Nauman, in terms of the state allocation, well, I'm sorry, let me take it back a step. You've got $316 million that are going to 2 counties. And in terms of the state allocation, can that go anywhere then to cities, the other counties, school districts? And that's one question. The second part of the question is, if it's determined that the counties, and we're talking about my county, so I should be a little bit careful. If it's determined that the counties don't need as much money for COVID-related expenses, does the state have the ability to reallocate that?
Mr. Nauman.
So, Madam Chair, Senator Cohen, what I will offer is that there are 3 additional funds as part of the CARES Act that we haven't yet talked about that travel through the Department of Education in Washington. And those funds total, in one case, looks like about 16 to over close to $30 billion of additional revenue. And there are estimates for Minnesota as well. I think my answer to you with respect to education spending is that those funds are designed to help school districts and schools throughout the country, and Minnesota will receive an allocation for that. So there's more to be learned here and more understanding to be had. I don't see anything in the law related to the coronavirus relief fund that would preclude the state from using part of its essentially $9 billion towards the schools if it so chose.
So I think we're at this point,
available.
Okay,
At this
thanks.
point, Mr. Nauman, we're going to go to Amanda Raful, the Group Director for the Fiscal Affairs Program at the National Conference of State Legislators, and Erica McKellar, who is the Program Principal for the Fiscal Affairs Program for the National Council of State Legislators. And they might be able to shine a little more light onto this. Ms. McKellar, welcome to you all, and I hope I can see your face here. Who would like to go first?
Well, this is Mandy. And actually, I'm really just here to help answer questions. Erica has some prepared remarks
Okay.
to this. And
Okay.
so I was just going to do a little welcome and thank you for having us on behalf of NCSL. So I will just skip all that and let Erica go ahead.
Thank you. Good
Sure,
morning.
yeah.
Let's go.
Good morning. Thank you. Thank you for having us here. We really appreciate it. Some of the other presenters have covered some of the topics that I was going to cover. So in the interest of time, I'll sort of gloss over some of those points. But I think what I was asked to provide is kind of a high-level overview of what we're seeing in some of the states. We're working on tracking the fiscal conditions around the country and some of the measures that states are taking in response to the COVID-19 virus and looking ahead to what sort of an economic recovery might look like. So I'll just kind of briefly go through what we're seeing. One of the most immediate actions we saw states take were supplemental appropriation bills for healthcare related costs. 19 states, including Minnesota, enacted some of those laws. And we've also seen states start to dip into their rainy day fund accounts in response to the virus. We have 7 enacted bills so far and another 3 pending in states. As the other presenters mentioned, one of the greatest challenges that we see facing states right now is estimating revenues. As everyone else mentioned, there's still so many unknowns out there around this. I think estimators are waiting to see when the virus will peak, when the economy will be able to reopen and what the economic recovery will look like. So a lot of estimators are waiting right now for more information on sort of the magnitude of the revenue issues facing states. Those revenue estimates will be complicated by these tax filing extensions. All states have now extended their tax filing deadlines, and 39 of those states have enacted them on July 15th, which goes into the next fiscal year. So that will push some revenues that states had budgeted for in fiscal year 2020 into fiscal year 2021. We know that some states are hopefully looking to release some new estimates in April and May, but we have seen some preliminary estimates, and I think these are already outdated, and the magnitude is probably greater than these illustrate. But a few examples: Missouri is estimating a $500 million shortfall for the remainder of fiscal year 2020. Vermont's projecting a 15 to 17% reduction in total fiscal year 2020 revenues, or 2021 revenues, excuse me. California is anticipating several $1 billion less in capital gains tax revenues. Colorado is projecting a nearly $1 billion shortfall for fiscal year 2021 based on bills pending in their legislature. That was before the state shut down the economy, bars and restaurants, and those types of restrictions. And New York just began its new fiscal year on April 1st, and they had nearly $10 billion less revenue than they had anticipated for that. So, preliminary numbers, but certainly staggering. As the other presenters mentioned, we expect these revenue shortfalls to be accompanied by spending increases in the states. We've all seen the skyrocketing unemployment claims coming out. And if the economic recovery is slow, more people could be eligible for programs like Medicaid and some of the other social service programs that we've talked a little bit about today. So the states we've seen are starting to brace for this hit to their revenues and economies in a few different ways. Some states have passed base budgets that they're planning to revisit later. States that still have budgets moving through their process have started to cut spending from those fiscal year 2021 budgets. New Jersey and Missouri have frozen fiscal year 2020 spending. Rhode Island is borrowing money from banks to complete their fiscal year 2020 spending. And last week we saw Utah's governor release the first economic recovery plan we've seen so far. It doesn't include a lot of detail yet. It's really sort of an outline, but they've broken everything up into 3 phases: urgent, stabilization, and a recovery phase. Each lasts around like 10 to 12 weeks, and we're currently in the urgent phase according to where Utah is. And a lot of what they call for are relief and loans to small businesses and use of reserve funds at this point. And they are expecting to release some more details soon. Some good news is that, rainy day funds around the country have been replenished since the end of the Great Recession, and a lot of states have been doing budget stress testing to try to assess their readiness for another recovery. I think those have, made states more prepared to deal with this type of economic crisis. The $2 trillion stimulus plan that Congress passed last week is also good news for states. Eric mentioned that there is $150 billion for state, local, and tribal governments in that. We have had some preliminary discussions with the Treasury Department about what that stimulus will look like and what it can be used for. Again, a lot of unknowns, a lot of unanswered questions. But our current understanding of the way those funds will be transferred is qualifying local governments will get those directly from the federal government, and then states will receive a transfer to their general fund. They expect it to rely heavily on the audit process after the fact. It will be a reimbursement program. So paperwork and documentation will be key for states. And they confirmed that supplemental appropriations that were passed before the law was signed should be eligible for that program. As Eric mentioned, there is a lot of concern in states that none of this money can be used for revenue shortfalls, which I think will be the greatest cost to states. At this point, they're expected to be used for state expenditures related to the coronavirus. And I think the biggest guidance that we're looking for from the Treasury right now is what will be considered a related expenditure. So we have been talking with them, and we're hoping that those guidelines will include enough flexibility to be really helpful for states. We're currently taking questions from states that we can pass along. So if you guys have specific questions about what the money can be used for, things you'd like to be able to see that it could be used for, please feel free to get in touch with us. We'd be happy to pass those along. We have asked states what their biggest direct costs related to the coronavirus will be. At this point, they're largely related to medical equipment like ventilators and healthcare facilities and infrastructure. Other costs that have been mentioned are IT-related upgrades, small business loans, and unemployment insurance claims. Longer term, as states look to jumpstart their economies, we see states anticipating, maybe some more economic development spending, continuing loan and relief for small businesses. States are also worried about losses in their pension funds and continuing unemployment. So we're hoping that Treasury will consider some of these issues as they issue their guidance. But we're also hearing a lot of talk about Stimulus 4 from the federal government. So we are working to provide input to Congress on the type of aid that will be useful for states in that, and hopefully pushing for some use of revenue loss in that. And we welcome your comments and inputs so that we can be as informed as possible for those discussions. We're tracking this information all on our website. You can link to it on our main page, or I'm happy to send that around, but we are doing our best to track this in real time, even though there's a lot of uncertainty and unknowns out there. So if there's anything that you need, please feel free to get in touch with us. We are here to help provide you with as much information as we can. So that's all I have. Thank you.
You're muted, Senator
Sorry,
Rosen.
Senator Rosen. Yes, I think you're muted.
All right. Thank you, Ms. McCallum. Appreciate that. I want to turn to Senator Benson real quickly, guys. I know she has to jump off for 1 o'clock.
Thank you, Senator Rosen. And Ms. McKellar, I understand the local money is going directly to local governments. I believe you stated that federal money will go into the general fund, do you believe that means that the legislature will have authority over those appropriations after we get federal guidance, but that legislatures will be responsible for appropriating those funds?
Ms. McKellar.
Yes, I think it will be on a state by state case basis. We have an older report on how unanticipated federal funds move to states. And in some states, the legislature does not have much of a role in those unanticipated funds. And in some states they do. And Mandy, I don't know if you have it up or have looked, if you know specifically what Minnesota's listed as.
Let me look. So it shows Minnesota, it looks like the executive has primary responsibility with the legislative has an advisory role. Is that how you typically treat unanticipated federal funds?
So Senator Rosen or Mr. Nauman, that means the federal funds would come in and the LAC would have to stop them in this case, instead of going just directly into the general fund to be appropriated. So we might
My hope,
out.
Senator Benson, is that we do create a separate fund for these federal dollars to go into, and they would have that same oversight as far as what is being appropriated from the executive, from the governor, and it would have the same framework as we've had with the other dollars that have been going to the governor. But I'm open to suggestions if there's another another way of doing that, or perhaps we should take a look and appropriate them from the legislature.
Agreed. Thank you,
Mr. Nauman.
Senator Rosen.
Just to answer Senator Benson's question, under current law, all federal funds go into the federal fund. And there is a statutory appropriation in Chapter 4 that provides the executive the authority to allocate those resources, obviously through the LAC process. And that's a pretty routine, I won't say, it's a pretty normal process that we've used. So for the legislature to do something different, something similar to what was done during the last recession, a fund was established and the money was put in there. It could be done somewhat differently, but it would take legislative action to make that occur.
Senator Benson, yeah? Okay, good. Senator Chamberlain.
Yeah, just real quick and easy. Ms. McKellar kind of alluded to this. You said all this, the comments you just made, that information is available on the website in CSL.
Yeah,
Ms. McKellar.
that's most of it. Some of these preliminary, some of these preliminary estimates may not be up there. We're trying to limit the preliminary estimates that we're reporting on our website to some of the official estimates coming out of governor's offices or legislative fiscal offices. A few of these are just sort of things we've heard. But yes, for the most part, all of this information is available on our website.
Would you mind terribly making your providing us your testimony, the written testimony? Could you do that? Hard copies?
McKellar.
Sure, I'd be happy to do that.
Thank you. That's it. Thank you.
Thank you. And Ms. McKellar, I hope that you keep us to maybe just a personal touch with Minnesota. Let us know if there's anything that we should be working towards. I would like to look at providing you some comments about what we need for a stimulus aid package. Anything that you need from us too. I hope it goes back and forth. Senator Cohen, I know I kind of cut you off before. Was there anything further that you wanted to ask?
No, I was fine, Senator Rosen. Thank you.
Okay, perfect. Anybody else have questions? No? Okay, wonderful. Thank you very much. Thank you, Mr. Nauman. Thank you, Ms. McKellar. And thank you very much, Ms. Rafool. Appreciate you coming on. Senator Gazelka.
Well, again, yeah, thank everyone that helped participate. As I said yesterday in my video that I released, that we're all working together in the end to defeat this and to get Minnesota back on track. I really think that's an important part of what we do and who we are. I do want to give a little wrap up of some takeaways that I have here. It's obvious that the coronavirus has dramatically changed our budget forecast and where we're going, and I think there's multiple confirmations of that, and so we need to rethink about what we do about that. We fully funded government last year, what is that going to look like as we move into next year, and what do we do about that? Dedicated revenue streams that fund extracurricular things, maybe we need to take a look at how we do that. I appreciate that Commissioner Frans talked about needing to be surgical, that there are some areas that obviously that we may not change at all, but maybe other areas need to change. He mentioned a state government hiring freeze. I think that's a good start, but again, what are we going to do going forward when the numbers look really, really bad? I appreciate the conversation about can Minnesota actually provide a stimulus that really it's the federal government that does that. There was some conversation about a bonding bill, and I think that's a good idea that we consider one. But even that was mentioned that we have to be careful with that because we still have to pay for that. And so we'll work through that together. I think one of the things that really stood out to me is in the light of stimulus and what the state can do versus the federal government is to focus on activities and things that actually don't cost a lot of money but could still potentially provide stimulus. And one of the things that came to mind right away for me is delaying some of the taxes that our business community have to pay when they don't have the money. That could be something because we want them to survive, as Neil Kashkari talked about the other day, is it's important that these jobs and the businesses that provide them survive. And then the other thing I thought about right away that doesn't have to cost a lot of money is consider what regulations we could ease temporarily to speed up the speed of a business starting and actually then creating jobs. I mean, those are some things that don't cost money that we could actually do. So I encourage everybody to start thinking about those as well. So again, thank you. For tomorrow, we have another hearing scheduled to focus on long-term care and some of the issues that they're addressing. That will be at 11 o'clock. So again, thank you for everybody joining and all the senators that participated. Senator Julie Rosen for moderating it and the testifiers. It means a lot to us, and I think it'll help Minnesota and the Senate do as good as we possibly can in this situation. Thank you now. I'm disconnecting.
Thank you.